he took my hand and he walked me around the hall and said, they're firing us. The vendor is firing the customer.
This is insane.
Yeah, the pain of not solving customer problems was more painful for us than the pain of losing revenue. I parachute myself in Des Moines, Iowa. We went deep and deep and deep. The customer delight was amazing. But what was more amazing was the customer saying, we were so used to not having recurring checks and money coming in. If the competitor's product is good for the customer in some small sliver of use case, recommend that to the customer.
How should founders who are starting there, who want to build world-beating companies, what can they do differently? Kanav, thank you so much for joining us at Lunchbreak with Lightspeed.
Sounds good.
And joining us for the last nearly decade now of
It's
working
been a
together.
decade, yeah.
I know. Today we're just going to talk a little bit about not only the Innovaccer journey, but also sort of the ups, downs, pivots, emotions of the journey a little bit, and get into a little bit of the personal side of how founders manage these journeys rather than the cut and dried PowerPoint presentations that people think this is about. Maybe just, again, for the audience, just give a little bit of background on Innovaccer. We don't need the full journey, just sort of, you started in 2014, 15. Where is it now? What's the scale like?
Yeah, we started in 14. We were horizontal. We moved to vertical in healthcare 2016. Since then, it was 0 million or 0.5 million of ARR. Now it's 150 plus, touching 200. And it's almost turning into profitability. So it's a pretty good journey for the last 8 years.
That's amazing. As investors, you know, we love to see founders that take bold bets. I will say this one was one of the boldest ones we've seen.
Yes.
You were at, middle single digit revenue, $4-5 million. And I remember, post the Series A that we were part of, we had this discussion. You were a more horizontal analytics and data platform at that time. There was a very robust discussion on horizontal, like there were many such platforms out there. How do you differentiate? And you were going to go and think about it. And if I remember correctly, a month or two later, you came back and said, we've made a very interesting decision. So I wanted to just have you take us through that thought process that Sandy, Abhinav, and you went through, and what happened?
Yeah, no, that's still remember that date. We'll come to that. So when we started the horizontal data platform business, right, the thesis was data storage was getting cheaper. Organizations will store more data than they need, and they will not know what to do with it. So they will need a platform to organize, manage, analyze data. So in the early days, we were like MVP of Informatica, SaaS, and Tableau. So ETL layers, compute layers, and dashboard layers. We had customers like Wolters Kluwer, NASA, Disney, Harley Davidson, Mercy One. So we were like entertainment, financial, legal, all industries. The framework was either we stay as one of the best data management softwares that the world has seen and stay horizontal, or we solve real business problems with data platforms and go vertical. And we realized our DNA was more on solving business problems as the founders versus being at the interplay of hardware and software and optimizing data computes. So we chose the vertical stack. The funny moment, it was October 16, 2016, I still remember the date.
Oh, wow.
When I went to our biggest customer, which was not in healthcare, the topic of the meeting was to go from 50K of MRR with them to 150K of MRR with them. So thrice upsell within one meeting. And I turned the meeting over to say, let's go from 50 to 0. And the VP was like, he took my hand and he walked me around the hall and said, they're firing us. the vendor is firing the customer. So that was a very interesting, walkway conversations. But we did that with all the customers and said, hey, we are moving to healthcare. We can help you in the transition. We can find you partners to transfer all the IT stuff we built for you. But the reason why we chose healthcare was we looked at multiple industries at that time, about 3 of them. When the industry is very stagnant and not changing, incumbents have a very upper hand compared to a new startup. But when the industry is shaking up, everyone has a level playing field, a startup or an incumbent. And back then in healthcare in US, it was going from a fee-for-service to value-based care, which is a very nuanced concept. But in short, hospitals were trying to become insurance companies. And they had a stack to be a hospital, which is a very transactional stack. They did not have a stack to be insurance company. And no vendor or incumbent at that time had that stack offering for them. So it was a very level playing field for everyone. And we saw that window and we jumped in. And it was a very bold move, going from 5 million to 0.5 million of ARR in one day. But the rest is history, and it's a good one.
So this is insane.
Yeah.
First of all, turned out well. But I want to spool back a little bit. I understand how you implemented the decision and talked to customers and fired them. But let's walk back a little bit. How did you even come to that decision? Wasn't it hard? What was it on a personal level to sort of do this? And where did you get the courage as a founding team to go do this? I mean, who gives up revenue?
I think the harder part was not that. The harder part, which actually made the decision very easy, was we were not feeling it right, that we are solving real problems. Like we were sitting at the surface level of every industry. We knew a bit about entertainment industry. We knew a bit about legal, a bit about finance, a bit about healthcare, but so little that all our conversations with customers was like, you teach us more on what to do, and we are at the helm of what you say, right? So we're feeling handicapped, if you will, to solve their business problems. And we realized we need to focus in one industry. So the pain of not solving customer problems was more painful for us than the pain of losing revenue.
But tell me this, there's a whole software industry built on horizontal infrastructure software, but they're very successful companies, right?
Yeah.
So inherently, it's not a bad thing to be horizontal. What was it here that drove you in that direction?
That's a good point. I think when I meet a lot of more B2B founders in the ecosystem as well, and I want to invest in them also in some cases, I look at the innate love for solving business problems.
Okay.
So this B2B founders have this affinity of solving business problems versus scale. Let me bring a horizontal scale CRM versus let me get a true ROI for my customer. Let me help them increase their revenue or reduce their cost. So I think V3 had that.
Okay.
And that just made us stick to vertical.
I understand how you said this is a nuanced view that the healthcare industry was changing from fee-for-service to value-based care. Mm-hmm. How did a team that wasn't deep into any vertical get to that nuance before making that decision?
Yeah, it was funny. So when we took that decision in October 16, before that decision, so let me go back to June of 15, right? We are going out and selling to every industry and saying we have a data platform. We don't know what problems you want to solve, but let's talk about that and let's solve your problems. And there came one customer called Mercy One from Iowa and said, we have a bunch of databases to connect to and analyze some data. And our previous vendor could not solve it for the last 18 months. And can you do it in 4 months? And we're like, sure, if you put more skin in the game, we can do it. And we did that. Fast forward January of 16, they said, can you build a value-based care stack for us? And we had no idea what that stack means. And May of 15, we were ready with the first prototype. The customer that was the worst meeting ever. The customer was shouting at us and said,
Wow.
"What the heck is that?" And I parachute myself in Des Moines, Iowa, and the team as well with us. And in those 3 months, we literally camped in the customer location. We learned healthcare. We learned value-based care. We went deep and learned the quality measures and all the diseases and all that stuff. So we went deep and deep and deep. Like we went 5 layers deep in healthcare and value-based care in those 3 months. And the customer delight was amazing. But what was more amazing was the customer saying, we were so used to not having recurring checks and money coming in. We asked this customer, we're going to send you the first check and it's going to be $125K every month. And they're like, what do you mean you want to send us invoices every month? We're just going to wire the money to you. We're going to automate the wire for you. We were like, what is that? What does that mean that you're going to automate the wire every month to us? And that was the delight. And once we saw that focus, what focus can do in 3 months, when you solve a real business problem, is when we A, took the decision even more strongly, but B, learned about this trend. So I think the key is just camp at customer locations and just be there.
Yeah, I wanted to ask you, many questions for me come up based on what you just said. This one specifically, in this day and age, first of all, we've gone through the pandemic, everybody's on Zoom, lots of meetings are still on Zoom, you barely get to meet anybody in person.
Right.
What caused the folks at Mercy One to allow you into their lives in such an intimate way, in a sense, to meet them every day, every week, whatever it was, and get so deep and have them teach you? Why would they do that? Most of the software vendors we work with, the customer's barely giving them 30 minutes, and even then they're checking their email and so on and so forth. It's what a lot of people say about VCs. So
right.
I will give that. But what was it that made them do that, and how can other founders learn from this? Like, how do you get close to a customer in the way where they let you into their lives?
Right. We have a famous saying, right, which is the hottest chick in the bar will never give you the attention.
Okay.
Don't find the hottest chick in the bar.
Okay.
Right?
Oh my God.
Go
okay.
in the medium pack.
I
right?
didn't realize we were going this direction, but okay. All right.
But
Makes sense.
Imagine, a new startup founder in healthcare says, I want the attention of Kaiser Permanente. You won't get it. There's no chance you will get it, right? But there are a lot of these health systems or customer in any industry who are middle in the pack. Don't go small, don't go large enterprise, go middle in the pack, who are deprived of tech vendors coming and trying to solve their problems.
Like nobody shows up.
Nobody shows up to them. Who shows up in Des Moines, Iowa, of all the places, right? And we were there, and they were like, okay, when are you leaving? Tonight? I was like, no, we're staying here. They're like, what? That's amazing. So I think they want the love. They don't get that love. I think those all-in moments just teach you that the most value is created during all-in moments. Like what I did not tell you is when the customer in May abused us almost on the first frantic call, said you have 3 months to fix it. And ironically or accidentally, August 26th was my wedding date. So I literally told my wife, either I save my company or I marry you. And I did both. Right? So those are those all-in moments that have just, shaped the company.
Yeah, that makes sense. You moved here, all three of you, pre-pandemic. What was hard about those first few years of moving here? Can you just give us a little bit of feel for that?
Yeah.
For founders who have not moved here yet?
Founders by innate nature are agile, flexible creatures, so they can live anywhere. So I think porting yourself from one country to other is not a big deal. I think the bigger deal is being out there and network more. I think we learned this the hard way, that US is a easily networkable country. You can go out and talk to people and they don't, stare at you. So that's a thing that we take time to learn. I think the founders can just do it from day one.
How did you, in that context, build your management team? And how did you attract sort of a management team into the company that was so well calibrated and so accomplished? Jonathan Bush came onto the board as an independent board member, founder of Athena Health. And then you got Dr. David Nace, who joined the company as a chief medical officer.
Right.
A lot of founders coming from elsewhere will be like, hire other people from their region, wherever they're coming from, who are here.
Right.
Whereas you went out and hired sort of a more diverse management team.
Yeah. Yeah, no, that's a good point. I think that was one of the good moves we made. I think in some way it was naivety. Naivety of changing healthcare. We were not from healthcare, and we were kind of breaking the boundaries and the barriers, and of saying out loud that we can change it, and it's doable. And our voices got heard. Our voices got heard from people like Dr. David Nace and Jonathan Bush, and was like, these young kids coming from India who have no idea about healthcare, and they are so confident that they can change it. And when we talk to them, they have some substance in what they're saying. So the passion just rubbed off.
Okay.
And Dr. Nace was like, I would love to join this team, and he was the force, I would say, who kind of brought all the industry leaders together to us. So we just had to get one to get the next five.
Yeah. It's something that we've seen over the years has developed into sort of a playbook, and something we've learned from you. Innovaccer was our first SaaS investment in India.
Oh, I didn't know that.
And
okay.
so we'll
talk about that more.
We'll talk about that. And we learned a lot along the way, and that playbook has now, you will be happy to know, been replicated across a lot of our portfolio companies.
Playbook, yeah.
It's not even building an advisory board, it's just finding that first person who is from the industry that you're selling into. So if you're a security company, hire somebody who's been a CISO or been in that industry for a while as an advisor. Or if you're in healthcare, hire somebody who's been a chief of staff of a hospital.
Right.
Or if you're in financial services and insurance, hire somebody who's been in the insurance industry. And in what we find in most of these industries is there's people who've been in that industry for 30 years, and they're available. They have deep domain knowledge, and most importantly, they have contacts.
Right.
The old boys network, as it is, they know all these folks who are running other hospitals, or who are insurance company executives, or who are whatever. And they're happy to help and open doors. Of course, the founders have to walk through those doors and convince the buyers to buy and engage. But the door opening is really important attribute of these advisors. Think of it as lead gen, and we've replicated. I'm maybe a little bit more on that front. How do you find these advisors?
Yeah, I think when we met Dr. Nace, we met probably 10 other Dr. Naces in the industry, right? And I think what struck the most with him was he reciprocated back the time and the investment during our conversations. It was not a one conversation. It was multiple conversations we were doing with all these people. And Dr. Nace spent the most time back with us and said, oh, can I connect you with this person? And let's meet with this person. And I challenge you back on this strategy, right? So he was going deep with us. That was the first signal. I think the second signal was we never discussed employment at the get-go. We talked about some advisory, some consulting here and there, and we made him join one of our board meetings. That's when he met you. And so we made him join a customer meeting. We flew him to one of our customers. So we kind of eased him into an employment, because a person that's senior, if he or she is not passionate to run the next decade with you, he or she will slow the culture down, right? With your company as well. Dr. Nace is probably in his mid-60s, but he's a young 40s by heart and by his gymming and athletic body. His passion of that young culture just fueled fire and got more people in. So I think that was one. And we never like said, okay, let's, join us immediately. We took like 6 months to evaluate him and him evaluate us more than us evaluating him, because we were pretty small, back then. So I think it's that I would say I would recommend, just spend 6 months with 5 or 10 people and see who reacts with, who likes your culture and you like his or her culture, and then kind of get them into the fold.
Maybe I'll shift gears a little bit to the pandemic. Of course, March 2020 onwards, through 2021, the world changed.
Right.
You were in the healthcare business,
Right.
and this was obviously a healthcare pandemic.
Right.
How did that affect your business fundamentally in terms of more on the demand side? And then secondly, obviously on the capital supply side, the world went crazy.
Right.
After an initial shock, and interest rates went down and capital sort of became widely available. How did that impact sort of how you thought about your business?
No, good points. I think I'm going to solve it in 2 parts. You asked a 2-part question. I think the first is the COVID pandemic. So March 11th or March 10th, I forgot, the lockdown happens on 2020, and then for the first 1 week, as usual, we were all figuring out our ways of working. How do we all work? How do we all operate? I think end of March till June of 2020, I still get goosebumps, talking about this. Is that moment was one of the moments when you think like it's something beyond us that happened, right? So all customers were obviously facing the pain.
Yeah.
They were at the front lines. Not just at the front lines of helping everyone, they were at the front lines of having a financial shock, because hospitals makes profit margins from elective surgeries, and they were all gone. So they were bleeding red on the financial statements, and they were bleeding red on the front lines. So it was a crazy moment. And we at Innovaccer said, we are gonna do anything we can for them without asking any money in that period. So no upsell targets. All upsell targets were washed off in that period. And it was all about retention for us and value for them. We built a telemedicine app from scratch, a symptom checker app from scratch, a COVID management dashboards from scratch, critical supply chain dashboards from scratch, all of that in those 2 months. Those were products which we would have taken 1 year to build in a normal Innovaccer cycle. We built them in 2 months. We rallied cry around the company. Not just we launched products and built products, we deployed them in all the customers, which is the hard part to do. You can always build products in your own lab, and you can't deploy everywhere. We deployed this across the board. And that was our love to the customers. But the love we got back from them was just amazing. Because that's the moment, Dave, when we went enterprise. Our first enterprise customer signed the contract. They were stuck for 12 months in a sales cycle. But when they saw what we did for them during COVID, they were like, you know what, guys? I mean, our supply chain dashboards were refreshing every 1 week. You made it refresh every 1 hour, and our team can just look at it now, and they can operate more proactively of when the supplies will end, of replenish. And we did all that for free for them.
Okay.
They just signed a big contract, and that word spread around that Innovaccer is a very customer obsessed, supportive company, and that changed our enterprise culture altogether. So I think for us it was the defining winning moment.
In an interesting way, if I compare Des Moines to Phoenix and your experience in these two, in Des Moines you created the intimacy with the customer. You just showed up there and you won't leave.
Right.
You created your sort of moment. In Phoenix, the moment got created for all of us and for you, where the
Right.
pandemic had happened and providers had, faced a lot of challenges,
Right.
and you went and helped them without asking for anything.
Mm-hmm.
And that created a special bond as well. In both cases, the bond got created, information flowed, trust got established.
That's a
And,
good
and if
point.
I had to even zoom out further, it's sort of in times of, and this is maybe too generic, in times of change, maybe what you were talking about at the beginning of the segment here, there is opportunity to sort of create different types of relationships and build something different.
Right.
And you took that chance and opportunity and made it happen.
Right. No, you're absolutely right. I think I tell this to all my sales teams and customers teams. If the competitor's product is good for the customer in some small sliver of use case, recommend that to the customer. Right?
That's counterintuitive.
Yeah, because what happens is, I mean, the biggest customers we had and the biggest upsells we had are with people who we had the most intimate relationships with. Being more authentic in B2B just goes a long way, and it comes back to you after a few months. You don't see the ROI immediately, but you see the ROI in the long run.
Can you talk a bit more about authenticity? It's something that I don't think gets discussed enough, but when you're meeting sort of the SVP of AI these days, or the chief data officer or the head of EHR or whatever,
Right.
How can you be authentic? You're trying to sell them
Yeah.
on your product.
Right.
They're looking at 5 other products.
Right.
All those vendors are saying not so great things about you and depositioning you in one way or the other. You might be doing that to them, but where is the space for trust and authentic communication in the middle of this warfare or warfield, as you call it?
That's a good question. I think as someone famously said, you never sell features, you sell solutions. The way I will extrapolate that further, right, is when I go into a meeting, I don't say I have this or I just launched this.
I'm a salesman here. What would you like?
Right. I have the whole bag of items with me. The meeting starts with, how are you feeling? What is your pain point? What are you struggling with right now? How can I help you? There might be something that is not in my domain, but can I refer to someone who I know can help you, right? It's those moments that brings out the value that you can then latch onto. And you prove to them that if you take this is the value you want to get, because I understood your problem. And because I understood your problem, I can tell you the ROI. While the other vendor will just say, my product has a 99% accuracy in the AI models, and they will go away. So that's the way to be authentic.
And what is, maybe just even one level deeper on this, what does one see in the behavior of the potential buyer or people who are in that decision-making unit that leads you to that gives you a signal that they're engaging well with you, that they're engaging deeply with you, that there is some chance of something happening here? What are the signals there? Are they inviting you to dinner at their home? Are they talking about sports? Like, what is it that gives you that signal in these enterprise B2B scenarios?
Right. Something more than usual. So they ask you about the competition. It's a very interesting signal. Usually customers will never ask you, okay, tell me about this competition. Because the moment they say that, they have opened their cards. They know they're evaluating them, right? But what they're trying to do now is they've almost made up their mind, or making up their mind, that you are better than them, but they want to hear from you why you're better than them, right? So they just opened up something more than what they usually do. Or they're talking about business case with you. How do I build this business case?
They're asking you to help them make the case to their colleagues.
What usually happens there is in every B2B, especially at Innovaccer scale deals, which is like $1 million of ACV deals, a VP or SVP is making this deal with full trust on someone that they won't get fucked
Yeah.
in the next 2 or 3 years. That's all they're thinking about. Like will they be fine taking this decision? So it's the matter of trust, and if you get any signal around trust building, I think that's something to latch onto.
AI is obviously everywhere these days, and we see sort of AI native companies sort of, we hear stories from the outside of companies going to $100 million in like 6 months or 2 years or
Yeah.
whatever it is.
I believe that vertical software will start to win in the next 20 years. And the reason for that is horizontal players won in the last 20 years because the moat was how many features do you have? And the cost of feature development is going down to zero with AI.
Okay.
So that should not be the moat anymore. The moat should be, do you have enough vertical domain expertise to solve a real business problem in the verticals? So what I mean by that is 4 years from now, can any health system or some startup for a health system build a CRM for health systems? Absolutely. Or a CRM for anyone, for that matter. But can a CRM for a health system which understands how they acquire patients and how they renew patients and how they cure patients, that CRM will have a higher winning point than a full-scale HubSpot or a Salesforce for healthcare.
What is it that makes you believe that, let's say, a vertical CRM for providers will win over, I don't know, Salesforce or somebody else? I
Right.
mean, healthcare might be too clear an example almost because it's so esoteric, that
Sure.
ecosystem, but you can think of financial services, or you can
Right.
think of manufacturing, or you can think of media and entertainment,
Right.
or any category, right?
Right. Yeah, I think, okay, let's put the other claim. Let's say financial services. They have enough horsepower of developers in-house or pseudo developers or somewhat developers who can go on Cursor and build a new CRM for themselves, right? Today they cannot, sure, but 2 years from now they can, right? And so a financial service company can make a CRM in-house,
Yeah,
which they will.
because they've got the developers and the talent.
And now the AI is helping them to get the cost down, right? But here will come a vertical startup which will say, not just the CRM, that's not the only play. If you don't connect the CRM with the customer support service tool, and if you don't connect those two with the third tool for documentation, you will not be able to get the ROI. And I know how your workflow works and where you get the ROI, and I have built just that for you, right? So those are going to win any day compared to a horizontal sales force. So my point was that the horizontal sales force will lose to the internal developments of financial service companies.
Because the cost of development has come down.
Right.
Okay.
But the vertical software people were, and now let's look at the vertical software people. They were building one wedge to get into the industry, and then they were getting to their product 2 and product 3 and product 4 slowly. Now the speed of development for them also has gone faster. So now the vertical software people can also integrate the whole vertical stack much faster and build product 1, 2, 3, 4, 5, which used to take like 10 years to get there. So a good vertical software business should, in this stage of AI, build 5 products in 3 years and not 10 years. If they're not doing that, they're not leveraging the AI properly.
Yeah. Let's come back to India a little bit and companies that are starting out of India. We've now had, call it 15 years of software startups coming out of India.
Right.
When we did the math, about $8-9 billion of equity capital has gone into Indian software startups.
Makes sense.
over the years, in the last 15 years. Now, compared to the US, that's a drop in the bucket, but it's a large number. And the number of world-beating companies that have come out of that have been a couple of handfuls, right? How do you, first of all, do you agree or disagree with that? Secondly, is anything changing? How should founders who are starting there, who want to build world-beating companies, and we see that every day, and we're investing behind that theme in India every day, how should they think about that? What was it in India that held them back? Not them, but their sort of counterparts back in the past. What's changing? What can they do differently?
I think it's the ambition. They just need to be more ambitious.
But how does one founder say, okay, I have to go? Like, how does that work?
Yeah, that's a good point. So this is the contrarian view. Okay, so the classic Silicon Valley teaching is have a smart wedge, enter with that.
What we just talked about.
And keep on focusing on that, right? Which is true. But if you don't have the ambition to solve everything in that industry, you always become slow. So, always have that ambition of solving the whole industry, but have the focus of starting with one wedge. And what I see is either they start with everything and there's no focus, who are really, really ambitious, or they're not enough ambitious and they start with a smart wedge and they live in that wedge for 5 years and then they find the act 2 or act 3. With AI, focusing on a smart wedge and moving to your act 2 within like 2 or 3 years, not 5 or 7 years, is going to happen. But be ambitious to solve the whole industry. I think that's what's missing right now.
Thanks a lot, Kanav. Appreciate the sort of candid insights into the Innovaccer journey. I learned a lot just in this conversation itself, as I have over the last decade from you and your co-founders. And I wish you well for your next journey.
Yes.
I don't know if you want to say anything about that.
Yeah, I mean, I spent my last 1 decade in healthcare, and I'm spending my next decade or 2 in construction, trying to pick up an industry which is the biggest industry in the world and the least productive, or not, I wouldn't say least productive, a declining productivity for the last 3 decades. And it's a very interesting problem, and I would have to give my next 2 decades to it. So,
awesome.
look forward to it.
Best wishes on that.
Thank you.
All right. Thank you.